Welcome to the latest Outbreak Management Advisory Board. You're all very welcome today. Firstly, I'd like to go through a few apologies that we've received for tonight. We've received apologies from Amanda Hatton, but we have Maxine Squire, the Assistant Director for Education, here to substitute. So welcome, Maxine. Apologies from Ian Floyd, Phil Mettam and Mike Padgham. But similarly with Mike, we have Bev Proctor here to substitute. So welcome to Bev. I think a few people might join the meeting as we're going on in terms of our timings. And also apologies from Dr. Sally Tyra from the local medical council, who understandably says that she's focusing on operational pressures preparing for vaccine delivery, which I'm sure we will all appreciate and thank her for. The only other thing I'd like to formally know is that Stephanie Porter has formally replaced Dr. Andrew Lee as the CCG's representative on the board, and Stephanie's going to be doing an agenda item early in the meeting, so welcome to that role as a board member. The first agenda item is declarations of interest, so just to give anybody an opportunity to raise a virtual hand if they want to declare any interests on the agenda. I can't see any, so we'll say that there are none to declare on that item. And then we'll move on to agenda item 2, which is the minutes of the previous meeting, which was on the 18th of November, and any actions are arising. So just to check first if anybody's got any matters arising or any questions that they want to raise from the action list. I can't see any, so hopefully therefore we're all happy to sign off the minutes, and in a sense if you're not waving or raising your hand, I'll take that as consent to signing off the minutes. So thank you very much for that. We then move to agenda item 3, which is the one that I just mentioned. So Stephanie Porter is going to lead this presentation for us, which is an update on the mass vaccination. So therefore I will hand straight over. Thank you very much.
Thank you. Good evening, everyone. Members of the committee will be aware through national media that the Pfizer vaccine has been licensed, approved, and is the focus of early planning and implementation of the COVID vaccination programme. And in fact, the first phase has started. The government has ordered 40 million doses of the Pfizer vaccine, of which 800,000 doses are now available. So that's enough to protect 400,000 people, since we need to deliver this vaccine in 2 doses around 3 or 4 weeks apart. The Pfizer vaccine is safe and highly effective, but it is a complex vaccine to move. People talk about and use the phrase that it's fragile. So this information has become much clearer to us, and it's translated into our operational instructions, and we've been working as a health community to prepare and respond to this exciting but rapidly developing situation. The update that I have for you this evening is that the CCG is working with our primary care partners to prepare a small number of sites for our city and the Vale, because our CCG covers the city of York and the Vale of York, and we'll be ready to take a small amount of the vaccine pre-Christmas. So please bear with us as we work through this. No one will be excluded from the vaccination programme, but it will take months to roll out, not days. So the phased vaccine supply means that the bulk of the vaccine for high-risk groups will inevitably take place between January and April. So great vigilance is required before then to prevent a third wave of COVID. Initially, the most vulnerable people in society will receive a vaccination. That means people over 80 and some care home staff. All prioritisation is being set to national level by the Joint Committee for Vaccination and Immunisation. And when we begin to offer vaccines, it will be to this specifically high-risk groups initially. So a bit more on the first vaccine. That's the Pfizer vaccine that you will have heard of in the national press. So it needs to be stored at around -70 degrees, and it comes in packs of 975 doses. You might have heard people talk and make reference to the vaccines coming in a pizza box. That's just quickly became shorthand. It comes in a box that's 23 centimetres by 23 centimetres and 4 centimetres deep. So you can see the level of detail and that we're getting into, and works underway to enable that to be split into smaller boxes. As a result of only a limited number of specialist sites, we've therefore had to just identify nationally who would be the first wave to receive this very scarce and precious resource. So it's mainly been hospitals, and we're now rolling that out into primary care settings. So we have some more vaccines that are due imminently, but the key message is we have very small numbers being distributed to designated sites. But as more product comes into the country, the rollout will be accelerated. Just a bit more about vaccines, because the government has in principle secured access to 6 different types of vaccines across 4 different vaccine types. So totaling access to potentially 350 million doses. The Pfizer vaccine that I've just referenced and that you probably have heard in the national media, there's access to 40 million doses. And then probably the next most likely vaccine that people have heard of is the Oxford AstraZeneca, and the government's secured 100 million doses. So based on 2 doses for the Pfizer vaccine per person, this would run to a maximum of 20 million people. But clearly we don't get all of those doses on day 1 or even in the first month. This is going to be a long-term programme, and we'll hopefully be able to get other vaccines along the way. So the major effort will be post-Christmas, and it will probably take until spring to vaccinate all the high-risk groups. So locally, we've been working with providers on a range of readiness activities, which include quite a detailed site approvals, a lot of work around staff training, and specific training programs relate to specific vaccines. So as more vaccines come on, staff will need retraining that is bespoke to the vaccine. And there's a whole range of IT systems that also need to both be deployed and for staff to be trained on, to make sure that the call and recall across 2 doses, to make sure that it's delivered safely, that people are getting the right and the same vaccine for the second dose. And we're taking on board aspects around people's preferences, allergies, making sure people consent to the and have capacity to consent to the vaccine as it's offered to them. So we'll also be rolling out national comms, and one of the key things will be the role that the public play in helping our vaccination programme. So you will hear frequently in the days and the weeks to come that we'll be asking the public not to contact the NHS to seek a vaccine. We will contact you. When we do contact, please attend your booked appointments, because not only is the vaccine incredibly precious in these early phases, actually we want to maximise the use of the vaccine and the use of staff time to really get the vaccine programme as effective as possible. And absolutely, please continue to follow all the guidance to control the virus and save lives. So that's the update that I have for you today. Yes, I'll conclude there. Thank you for listening.
Thank you very much, Steph. That's appreciated. And just firstly, to open it for any questions or comments, just in case anybody would like to ask anything. I'm just having a little look. Charlie.
Thank you very much. Thank you very much, Stephanie, for the outline there. I think you said that the main wave of vaccination would be from January through to April. Do we yet have any reliable sense of how far down the priority list we will have got by April? We'll be down into 5-year age groups by then, certainly. How far down that list do you think we'll be?
It's too soon to say because of the reliability of the supply chain of the vaccine. So we'll be focusing our attention on, in order of priority, going down the over 70s, care home staff, hospital, NHS, frontline workers of all definitions. Then those priorities which are around comorbidities. So too soon to say, but we're currently modelling all of the delivery partners, hospitals, primary care networks, community pharmacies. So all of that prep work will be taking place pre-Christmas.
Thank you very much. Bev, I should have mentioned earlier, Bev, that you were joining us on the telephone, so anybody watching the meeting won't see you on the screen, but that you're with us. Over to you.
Oh, thank you. Thanks very much. And yes, again, thank you, Steph, for that very understandable summary. I just wanted to come back to the JCVI priorities, and as I understand it, care home residents and care home staff are the first priority. I just noticed you said the over 80s and some care home staff will be vaccinated. Is that running alongside the JCVI?
So, Bev, what we understand, given that the information is coming out and being adapted quite quickly, is that the way in which the vaccine reacts and can be moved multiple times means that at this point in time, we are not going into care homes as our first targeted cohorts. But as I say, that's being discussed on a day-by-day basis. I think we had some comms last week. I'm pausing because the days are merging into one, where we were planning on what we're describing as a roving model. And we are still planning for that at the point at which we get more confirmation of the stability of the vaccine.
Thank you very much.
That's great. Thank you.
Thanks, Bev. I was just going to say, I can see Sharon wants to come in. Sharon.
Hi, Bev. I just wanted to just confirm what Steph has just said. Really, the priority list that the JCVI have produced hasn't changed, and so care home residents and staff are still a priority, as you say. But just to reinforce what Steph has said, that it's really down to the practicalities and the actual logistics of getting the Pfizer vaccine to where it's needed to be. So at the moment, it's only being delivered to hospitals and hospital hubs, and then it will, as Steph has said, it will be rolled out further. So you're absolutely right. The priority group hasn't changed at all, and hopefully, as Steph has said, the work on being able to break the Pfizer vaccine down into smaller doses and other vaccines coming online means that care homes, will be able to get access to the vaccine absolutely as soon as possible.
Thank you.
Thank you both for those. I can't see any other questions. So just to thank you very much, Steph, for that update. I know you have to go to another meeting in a second, but then I'm sure we'll see you at future Outbreak boards. So that then takes us on to agenda item 4. And at this point, I realised that I didn't give the apologies, as I promised I would, of Sian Bolson from Health Watch. So if they could be added to the notes through my forgetfulness, that would be great. So the next agenda item 4 is the current situation in York, and I'll hand over to Fiona.
Thank you. So I'm just going to very briefly run through the data that's presented on page 9 of the reports pack, and really just to highlight the key things on there. So the key message really from that is that the number of positive test results has been going down. So our 7-day rate per 100,000 in York currently actually stands at 60.3. So even since that paper was written, it has gone down a little bit more. So what that means for us in York is that on average we're getting about 17 cases per day in York residents. We've talked previously in this meeting about the positivity rate and wanting to get our positivity rate to below 5%, and that now stands at just over 2% in York. The peak cases that we saw in this wave was around the middle of October, the 16th of October. So whilst the majority of the cases that we've seen through this second wave have been in younger people, within that period there have been 19 deaths in our residents in York, which means that the death rate in York resident stands at 191 deaths in total. And then just also to draw people's attention that we do publish this data regularly on the York Open Data platform. It comes out every Friday, and people who do look at that regularly will notice that as we've been going along, we add in more data sources as we have those. So we're trying to be as transparent as possible and share data with people where we can. So I'll probably leave it there unless there's any particular data questions that anyone has got, and if there are any other colleagues, particularly in the NHS, who want to share any data from their perspective as well.
Thank you very much, Fiona. So open the item up in case of any comments, additional bits of information or questions. I can't see any at this stage. So in that sense, we're being asked to note that the update on the current situation, and thank you, Fiona and team for all the ongoing work. That then moves us on to agenda item 5, which is on communications and engagement, and a presentation on recent work. And I'll hand over to Claire.
Thank you. Are we okay to share it, please, Robert? Lovely. Thank you very much. Oh. So if we go to the next slide, just to remind everybody, I remind you all of this every week. These are the 4 messages that we're continuing to consistently share across the city. As we approach Christmas, we're actually going to add 2 more to these, and that will be one around airflow to encourage people to open windows and doors, and one around meeting outside where you can to encourage people through Christmas to actually consider meeting outside rather than in their homes. And we'll talk about Christmas and what we plan to do with Christmas as we go through the presentation. Next slide, please. So again, just a reminder, I remind you of this every time we meet. There are 3 phases to the management of the outbreak communications: prevent, to try and keep cases down and reduce the spread; respond if there's an alert as cases go up, or indeed if restrictions change; and then manage an outbreak itself. Next slide, please. Again, these just gives you an overview of the types of activities that take place, and it's just really a reminder of the things that we would be expected to do, whilst I go into some more examples. Next slide. So we shared this last time we met. As you know, we have regular communications that go out to everyone. And these are things like our partner newsletter, our direct communications, which are dropped to every household in York, our city, or during lockdown one we shared our A5 leaflets, our Facebook Live activity, and then as we have more insight around how residents are feeling or what kind of barriers we need to support them to overcome, we introduce other campaigns, and these are just an example of the other campaigns that have been introduced. And the one that we're pushing at the moment and really promoting is the emotional health campaign, whilst we prepare for the testing campaign and vaccinations, and I'll come on to that later. Just to pause here for a minute, during lockdown 2, which of course was the November period, we increased our Facebook Live to weekly. Now we're out of that and it back into tier 2. We'll be running those more monthly or for targeted information such as our budget consultation rather than specifically around public health. We can move on. Next one. Brilliant. So continue to share accurate and timely messages. This is really just to remind everyone that we came out of lockdown 2 on the 2nd of December and we were put into tier 2. What people would expect from that. We work very closely with the local media who have continued to be extremely good at sharing messaging promptly across the city and sharing that in all sorts of different ways. We've also continued to share our daily case data, which is featured on Your Vic Radio every day. And as you can see, we've shared the graph, which shows how much cases are declining, which is fantastic. Next slide. We continue to build confidence in the steps people take and what people can do, and these are our regular communications. So many of you will receive these, our weekly emails to yourselves, our resident newsletters, weekly business e-newsletters, which have been particularly important with the different business support grants that are available. Family newsletter, regular press, of course, social media campaigns, our weekly public health video, and then our city, the resident newsletter. So our resident newsletter is actually landing on doorsteps right now. Many of you might have received a copy or will soon to receive a copy. And I'll pick up on the different information that's shared in that shortly around emotional health. And of course, we've also featured our big conversation, the temperature check, which gives people an opportunity to tell us how they feel. If we'd like to move on. So we continue to build engagement through conversation, one of our key objectives for the communications for outbreak management. We held 2 Facebook Lives on the 27th of November and the 30th of November. So as we moved through the lockdown period, and then as we came out the other side and we knew we were more likely going to be tier 2 and what that meant for people, and particularly impact on emotional health. As a result of the changing to tier 2, we worked with our Director of Public Health, Sharon, who featured on local radio call-ins and was really well received. So a big thanks to Sharon for doing that. I know residents really appreciate the clarity and the direct communications they can have with you. We also, as I've mentioned, we've launched the second phase of our big conversation temperature check. And the temperature check is a survey. It goes out to all residents. It's available online and in our city resident newsletter, and it gives us an opportunity to ask all residents how they feel about their understanding of the public health messages. So while we're making sure the messages are understood and acted on, and also as a result how informed they feel and how confident they feel in using and engaging in the city. And that could be using public transport, it could be going to local shops, using parks, going to city centre, all sorts of things, so we can better understand the impact that the measures are having on people, the impact the communications are having on people, and therefore what we need to do about it. And just to remind you, our last survey that took place in August, the insight that I've already shared with you in previous meetings has led to at least 4 different campaigns, working directly with the university, the We're Covered campaign, which was about showing how different settings are sharing sharing how they keep people safe, so the face masks, the hand sanitizer in different buildings, and the amplification of Let's Be York messaging through outdoor, out-of-home activities such as wrapped around the hospital car park and on the racecourse. Next slide, please. So this is all about moving from lockdown to tier 2, so if we can move on. Thank you. So once again, I think every time we've met over the last month, we've moved from one sort of restrictions to another. So every time I seem to repeat this slide, but in different format. This time we went from lockdown into tier 2. Who knows what will happen next? And we continued to make sure we shared information directly with residents. So you can see an example there. The tier 2 guidance is a snapshot of our resident newsletter. We shared the government high alert communications. We updated our website, and we made sure that that was shared across as far and wide as possible through all of our different targets and all of our different networks, coupled with a little animation which you can just see peeping at the bottom left there, which was really to thank people for keeping going. So it was really disappointing to move from lockdown into tier 2 when we'd all expected to maybe get into tier 1, and we wanted to really recognise the efforts that all of residents and businesses have done to help us keep those cases declining, and to really encourage everyone to keep going, which is so important at the moment. We can go to the next slide. So we wanted to also show people what they can do. Lots of information here. Obviously, I don't expect you to take it all in, but basically it was to show people what you can still do rather than what you can't do. So we shared information for businesses, for families, for people, the different types of things that you can do rather than feeling that your lives were necessarily contained, whilst obviously pushing the very important messages of hand, space and face. Next message, next slide. Again, thank you. So this just gives you a snapshot of the kinds of information that we've shared for our emotional health campaign. This has been working very, very closely with many of you and many of your communications teams. It's a very much partner effort who've helped to shape this campaign, and we're very much appreciative of that. This just gives you an example of the different posts that have been shared by partners. There's also an example of the Our City content, and in Our City we shared a table of local support that was provided to us from York CVS, so thank you to them, which showed the range of different types of emotional health support available for people to access. And we also produced a business pact, so that's an email for employers or for employer networks to share with their employees, because of course one of the things that our big conversation insight told us in August was that 1 in 2 people across the city feel that their emotional health is worse off as a result of COVID, and we wanted to make sure that employers and employees particularly had that information to hand as furlough schemes change and as grants come and go. Next slide, please. So where are we now? We'll continue to plan our outbreak communications. We're preparing for the 16th of December. And just to explain, update you on the activity we're doing for that. So we are preparing for tier 1, even though we don't think we're going to get into tier 1, because we just need to have everything ready. Experience has showed us we don't have very long. If we get a heads up or a little whisper, we might get that whisper maybe 12 hours before it happens, you know. So we need to have as much information ready as possible so we can share with all of you good guys, so that you can share with your networks and we can get it out to as many people as possible. So although we don't think we're going into tier 1, we're preparing as if we are. And then coupled with that, we're preparing for Christmas. So you'll see going out and about across the city, much more information around how to look after your loved ones at Christmas. So we're going back out to our out-of-home advertising spots that we've got, that we're very grateful to partners for providing us with. The A1 boards, shopping centres and shopping districts, boards within the city centre itself, posters for shops and shop windows, etc. And that's really to play on the fact that this Christmas, let's keep our loved ones safe. Because one of our big concerns is, of course, and I know this is a concern shared across many people, not just in the council, is that with the relaxation of the rules at Christmas time, we might sleepwalk ourselves into a third spike, which leads to a third lockdown. And we certainly don't want that for the city. So we want to remind people at the point that they're most likely to do the wrong thing, if you like, and relax their social distancing or relax wearing a mask, that they're prompted to remember to put it on for good reason, look after the people they love safe, keep the people they love safe. So that'll be coming out over the next week. We've got a range of social media posts that we've shared with partners, which is a bit more fun and a bit more Christmassy, but it's again to remind people of those safety measures as we approach Christmas. And we've deliberately kept all corporate branding off those social media posts, because what we'd really like to see happen is that, of course, residents share them amongst each other. So if you've got family coming up at Christmas, or if you've got friends you're popping in to see over Christmas, that you actually share a message with them in advance about how to keep safe. Wouldn't that be great? And then we're sharing we're starting to work on testing, and we're hoping to launch testing in the next few days. And I know Sharon's got a conversation with you all about that later today. And we need to make sure that people know where to go, who needs to go there, and how to get involved in the process. So we're producing communications for that ready for the next couple of days. And although we're not actively promoting the vaccination process itself, we are starting to myth bust. So you might have seen various different communications out and about that are, if you like, against the science, and suggesting that maybe things aren't as safe as they could be. And we're starting to share the NHS information that demonstrates that, of course, this vaccination was developed with all the right protocols in place, and it is totally safe and standardized and been asserted as so, certified as safe. So we're myth busting with some of that. I think that's it. Next slide, please. Oh, that's right. I've just got the Christmas campaign to show you. So we've done a Christmas communications plan. One of the things that we're going to, this is all about Christmas, but one of the things that we're going to do as well is actually just after Christmas is use this campaign to start talking about how to keep the city safe. So one of our concerns is that after Christmas, complacency is really going to set in, and COVID fatigue will start to take hold. We'll have had a Christmas break, so we'll have met the people we love again. We'll have hugged our families, and we'll have reminded ourselves how difficult it is not doing so. Coupled with that, we'll know that the vaccination is out there, but not coming to many people for a great long time. And we need to manage people's expectations and keep them motivated in actually keeping our people we love safe and keeping the places we love open. So we'll be working with partners, and we've already started to have these conversations about how we can bring real stories of real people to the fore and show the stories that people have of their experience of COVID, of their experiences of lockdown and restrictions and the sacrifices they've made, and why they are choosing to keep going and keep following those behaviours and keep making sure they keep everyone safe by hand, space, face, and now airflow and outside. It's difficult, and we'll very much appreciate all your help to make sure we can keep those messages out there. And we'll be coming to you in the new year to ask you to share your own stories that we can then make visible and share through our own channels. So thank you. I think that's it. One more slide. There we go. That's just more detail of the campaign itself around case studies and real stories. If we'd like to go to the next one, there we go. And the final one. There we go. Thank you very much. So just conscious of time, has anyone got any questions?
Thank you very much for that, Claire. Just one comment from me and one question. You didn't mention, but I will, that your team won an award.
Oh yes.
in November. I'm pleased you didn't put it on your slides, but a bronze award at the Public Sector Communications Excellence Awards. And my understanding is that was particularly recognising the work of the team with partners in responding to the pandemic. Yeah. So congratulations at a public meeting. I was really pleased to see all of that work recognised.
Thank you. Can I just, sorry, Keith, just to interrupt, it's not just my award, it's everyone on this screen's award. So this is really genuinely a partnership award. I pulled the nomination together, and what I really spoke about was how great we work together, how supportive we are, and how we collaborate, and have developed some really great campaigns that have made a real big difference to our figures and our case data. So thank you to everyone on this screen and everyone that we work with who's not necessarily in this board. So thank you.
Great, thank you very much. And my question was about Christmas. It's something that I know we've discussed in lots of other meetings, but in terms of how can we make sure that as much information and advice beyond the government guidance, which I've read but isn't necessarily that helpful in all places, goes out through every possible channel and through all of our different organisations. And I was pleased to see in that slide, I think it was called case studies, what you and your family can do in different circumstances, I think would be really useful. But just to hear a little bit more about that and what others can do to help get those messages out now when people are obviously planning as this meeting goes on.
Yeah, thank you. So just before we started the board today, I shared today's partner update, and I wanted to get that to you before the board. Usually I send it after the board because it shares with you lots and lots of different communications, posts and messages that you can send through your network. So there's information about what people can do at Christmas, and there's also 2 sets of compressed files that you can share with your staff, your audiences, through your social media channels, through your internets, your intranets, all sorts of different things. And we'll continue to push that through you to send out through all of your channels and through all of your audiences, whilst we'll continue to put things in our resident update, of course, through the local media and through the radio, etc. But anything you can do would be really grateful for, because of course you have your own audiences that you can reach that we don't necessarily. It's probably worth noticing that the partner update goes to, we've had all sorts of partners come forward, and I'm really grateful for that. And if anybody's listening and they want to be on the mailing list, please do. But we've got different communities such as the traveller community and the Polish community also receiving the partner update. So we do make sure that goes as far and wide as we possibly can. Thank you.
Thank you very much, Claire. Sharon.
Yes, thank you, Keith. Just 2 comments really from me. I absolutely echo Claire's thanks to all partners that have been involved in all of the communications work. But I would like to put on record, Claire, my particular thanks to you.
Thank you.
A lot of this is, lots of people are involved, but it's your leadership.
Thank you.
And you're making this happen. So I wanted to put on record my thanks to you, and well done on the award. I still think you were cheated and you should have had gold, but anyway. And then the other point, Chair, if I may, is just say a little bit about tiers. For anybody who's listening, because Claire mentioned tiers in her presentation. So the government will be reviewing the current position around tiered restrictions on the 16th of December. We don't know yet what the outcome of the government decision is on that. It will be announced on the 16th, I understand, and then will be implemented. Any change will be implemented from the following weekend. My view, though, having been in lots of meetings and read all of the information that's coming out, is that there won't be any dramatic changes to those tiers so close to Christmas. And so my thinking on this is that York will probably stay in tier 2. I may be proved wrong, but I'll hold my hand up and say I was wrong if we go down into tier 1. But my professional opinion on it is that we're likely to stay in tier 2. And then the tiers will be reviewed again on the 30th of December. And then again 2 weekly after that. So as Claire said, we are preparing the communications so that we can get information out to people as soon as possible what tier we're in, but we won't know for sure until the 16th.
Yeah,
that's all I wanted to explain, Keith. Thank you.
Thank you very much for that. And it's probably worth saying that decision on tiers is a really important juggling act, where you've got the potential impact on businesses and the local economy that we're going to hear about later, and the difference that a lower tier could make. But then you've got the potential public health impact, particularly running up to Christmas, of changing that tier. And as you say, a number of meetings have been held to consider, for example, management of the city centre and space in York, if the what if we're put into tier 1 scenario happens. And as you say, there's a trigger point on the 16th of December. There's then another one on the 30th of December and onwards then into next year that I know we need to be prepared and ready for. A couple of bits of information. Obviously, we've been working quite closely with Lisa and Julia and their teams in the police in terms of understanding what if that happens and the particular implications for York, because we're surrounded by areas in much higher tiers. And I'm going to go to Julia next, as I'm sure she might want to add to that. And there is a meeting on Friday with the local government minister for Yorkshire leaders to follow up the meetings they've been having with officials on their approach to data and tiers, where hopefully we'll get more clarity on the criteria that they're considering, and obviously an opportunity to put forward that balance between the impact on business and the fact that we've done so well in York against that, giving us a chance to make sure that we don't jeopardise any of the public health response and progress that we've made on that. Julia.
Thank you, Chair. So that's the balance, isn't it, Keith? And it's a real tricky one. You know, we know that everybody is really keen to enjoy the festive period, but if we were to be put into tier 1, then we would have to really think carefully around the implications of that, the public health implications of that. It would create quite a lot of challenges, I think, for policing. I think tier 2 will present equal challenges in some ways, but I think it is really a careful balancing act. And I'd just like to thank partners for all of the work that they're doing around this, and Keith, the City Council, for really engaging around the community safety aspect of it. It is really appreciated. I do have a question, if I may, and I think this is probably for Sharon, and that is. I've mentioned this in other forums, but like many other parents, I've got a child at school, and I have vulnerable parents, and I'm really concerned about the potential of young people who've been in the school environment who may be asymptomatic, then mixing with their grandparents at Christmas, and the consequences of that. And I suppose it's advice to parents who are weighing up these issues at the moment, and how we can make those decisions and arrive at those decisions, whether we should be, for example, getting tests done or whatever it is. I think lots of people will be wrestling with this at the moment, and I suppose it's what your view is on that.
I mean, I agree. It is incredibly difficult, and I'm going through some of that same thought processes with my own family. So I completely understand the point you're making, Julia. I mean, I think it has to be for individuals and their families to determine what is the best thing for them. There's no hard and fast rule for this. What the note of caution, I suppose, is that we know things are changing for the better. We know that there's a vaccine on its way. Okay, it's going to take some time before we have enough doses of the vaccine to vaccinate everybody, but that's where we're heading, and everybody will get a vaccination at some point. And we know that there's more testing becoming available, and Fiona will talk about that in a little while. So I suppose I would caution people to just be very sensible. And if you have got elderly or vulnerable, clinically vulnerable residents, perhaps just wait a little bit longer before you give them that hug. You know, just be conscious of the fact that, you know, the virus is still out there. It's still freely circulated in the community. You don't know when you've been exposed and you might be infectious, even if you don't have any symptoms. So the importance of, you know, hand washing, wearing face coverings, though that social distancing is all still really, really important. And I know it's hard, but just imagine how you would feel if you know, spent a lot of time with vulnerable relatives, and then they became sick and ended up in hospital and perhaps seriously ill. If we could have been patient for a little bit longer, knowing we will be able to get together, we will be able to hug again, we will be able to kiss each other again, and life will get back to normal, it's just going to take a bit longer. So I would encourage people to think along those lines, really, as much as possible. But you know, every family is an individual, but you know, we're here to give advice to people and to help people work through their individual family circumstances, if that's helpful.
Thank you very much for that, Sharon. Andrew, just to welcome you as a guest to the board meeting, and I know you're here for the agenda item 7, but you're very welcome to ask a question.
Thank you, Keith. Yes, it might be one for Sharon or Fiona. Just bearing in mind what we're just talking about there in terms of families being able to meet for that period over Christmas. As we know, a lot of hospitality in particular have put a lot of measures in to be COVID secure, and it might be that some families choose to meet, for example, in a restaurant rather than residential premises. Do we know at this stage whether some of the current rules about meetings of no more than 6, will that change for that 5-day period? So if there was, for example, a family group of 8, they might be able to go to that pub or restaurant, or is that not known yet?
Fiona, correct me if I'm wrong, but I haven't seen anything in the guidance around Christmas to suggest that the rule of 6 has changed. But
no. So the guidance about being able to meet with so 3 households essentially joining as one over the Christmas period only applies to in your own house. So you know, so if you've got 3 families joining together, they can't go out for a meal, unfortunately. So it is about enabling that household contact over that period.
Thank you very much. I think a few others want to comment on that, Andrew, but I'm more than happy to come back to you afterwards. Lisa.
Thank you, Chair. And I think that's a really valid point that Andrew makes in terms of the safety of families and the COVID secure environment. And I just wonder whether from this group, particularly in respect of York and some of the venues and hospitality industry, is whether there's an opportunity for the board to pose that query back to central government in terms of that option. I appreciate it's difficult trying to contain it in a particular area, but I think it is a valid point, and it's something that we're worried about from a policing perspective, that being in tier 2 and the restrictions that brings, we think that more people will be driven to meet behind closed doors in households, creating even greater risk than if they could meet in a public place. So from a health perspective, we do think we'll get a lot of calls over Christmas and New Year about people breaching the rules inside households because they can't meet outside in a COVID secure environment. So I do think it's a valid point to consider.
Andrew.
Yeah, well, I mean, I think, yeah, I mean, I'd back what Lisa says. Obviously, I'm biased towards businesses, but I think, yeah, they were left rather sore with the news that obviously, you know, in the current circumstances, yeah, it feels like they're trading with one arm behind their back. And then when they saw the news of, you know, people being able to meet in residential, it didn't seem quite right. So I suppose whichever way it goes, and I suppose just the fact that we've obviously had the presentation from Claire, yeah, I suspect we may get some of those questions. So I think when we do the comms towards Christmas, whichever way it goes, which at the moment it sounds like it will just be in residential, we'll probably just need to make that clear. So businesses themselves, when they're taking queries from the public about whether this is possible, they're quite clear as to how they answer that.
Thank you very much. I can see Claire nodding to make sure that we pick that up on the comms. And that is something I did pick up through reading that the government guidance that had gone out, that the Christmas bubble arrangement is exclusive to private property and doesn't transfer to the existing rules. But I could see lots of nods when Lisa suggested that we made a representation on that point. So I'm more than happy to pick that up on that call that I just mentioned with the minister on Friday, and then send it through to the department, because I think it is legitimate in areas that have low rates, and as you say, potential not knock-on effect of people not being able to do that in COVID secure environments, as well as of course the impact on hospitality and business in what would be an incredibly busy time for them. Mark.
Yeah, I think just going a bit further from that, the other bit certainly that I've come across and speaking to both employees and neighbors and so on is some kind of, should we always say, confusion around outdoor events as well. So becoming aware of kind of community get-togethers in the square, so to speak, and that kind of thing, which actually people start kind of making up their own rules. What's is it rule of 6, or actually it's 6 over there and 6 20 meters away? And I think probably some clarity actually there required, so that people understand what is okay and what isn't.
Sharon or Fiona?
Yeah, I think that's absolutely right. I mean, at the end of the day, people make their own choices. We can, we can try and get the right information out there. We can encourage people to follow the rules. And the majority of people in York, we know, are following the rules. And, I've been humbled actually at how well people in York have followed the rules. But we also have the possibility to fall back on enforcement, either through the council's enforcement teams or the police, if we become aware of people breaching those rules. And fortunately, we've not had to carry out that much enforcement work, but our teams, the police and the council's enforcement teams will still be working over the Christmas holiday, and we won't hesitate to take action if we can see that people are not following those rules, because they're not just putting themselves at risk, they're putting other people at risk as well. So we'll certainly continue to do what we can, and really good points, Mark.
Thank you, everybody, for the questions and comments. So we'll take up those conversations as with officials and ministers where possible, and then I know Claire will obviously make sure that's emphasised in those communications that go out as much as possible to residents and through all of the partner organisations. So we in a sense have noted through that conversation the presentation that Claire gave. So thank you for that. And that then takes us on to agenda item 6, which is an update from the Universities and Higher Education group, and over to Charlie.
Thank you very much, Keith. The main thing that we've all been working on is our mass testing facilities to support the safe transfer of students from their university households to their family households. This has been done with lateral flow device testing, the ones that look a bit like a pregnancy kit. And they typically give results within half an hour, and the testee gets results pretty quickly after that. So it's quite quick turnaround. It's been a big logistical challenge getting testing sites up at the University of York and York St John University with very little notice, and a very challenging schedule of getting all of the consumables in the right place by the right time, but it's worked very well. Up to today, there have been over 8,000 tests done at both of those sites. And out of those 8,000, we have had 2 positive results, just 2, and around about 20 or so void results, in other words, tests that didn't succeed for one reason or another. We're told that that's a very, very low void rate, much lower than in other settings. That means all the rest of those tests were negatives. And we have discussed with Sharon's team the very, very low positive rate and whether we should have seen more, whether this is a feature of the accuracy of this testing methodology. But the broad message is that the low rates that we've found are reflective of the wider trends in the city. York's rate, as Fiona told us earlier, is about 60 per 100,000 per week at the moment, which is very low and much lower than it once was. The positivity rate for testing through Pillar 2 is 2.1%, so very low and well below the national average. And at both universities, we currently have a sum total of active positive cases, which is 10. So in a sense, we wouldn't expect to see many positive cases at this point in the cycle. So the transfer of students home should be a fairly safe undertaking. We've now had confirmation that we'll have this testing capability in place for the return of students in the new year. That return will be managed, or in the government's language, staggered over 5 weeks, with different cohorts of students on different degree programmes returning each week from the 4th of January. And the expectation is that students will be strongly encouraged to have lateral flow device tests on arrival to see if we can pick up any infections they may have accumulated over the holiday period. We're in discussion with Sharon's team about how best to deploy this technology and what lessons we can learn from the exercise that we've just gone through, or are still going through. It finishes on Friday for pre-Christmas departures. I can also report that the universities in York, together with Hull University, have been working with York Hospital and Hull Hospital to develop a collaboration around LAMP testing, which is the other high volume, quick turnaround testing technology. This is through a national scheme inviting university hospital collaboration, and is intended to support, in the first instance, the regular asymptomatic testing of NHS frontline staff. We also proposed into this scheme that should there be capacity, this could also be used to support testing in university settings. It's been a very complicated process working through the details of this scheme with a number of different partners involved. But it's not signed and sealed yet, but it is looking quite promising. And if it goes ahead, this will be with us for an initial period of 6 months. We only have a guarantee of lateral flow device testing for universities through until the 1st of February. It may be extended, early February, it may be extended. But this would give us another option to help manage the situation as we go through the spring. I think that's all I have to say today, Keith. Thank you.
Thank you very much for that, Charlie. Any questions or comments for Charlie? And a little bit like to Fiona, again, just to note, both to you, Charlie, at the University of York and also to York St John and the other further education institutions, just how much work is going on with your students, but above and beyond with partners and that last scheme that you mentioned with the health sector, I think is really, really commendable. So thank you very much, and please do pass that back on. So we'll note that update, and then we move on to agenda item 7. Agenda item 7 is an analysis of the impact on the economy, and this is something that we talked about at a couple of Outbreak boards, and thought we should bring it back here to just understand really the impact, albeit that we're sort of primarily focused on the public health response here. So really pleased that James, who's obviously a board member, is here, and he's been joined by Simon Berreton, Head of Economic Growth at the City Council, and also Andrew Lawson from York Bid. So I'll hand first over to James and Simon. I don't know who's going first, and then afterwards I'll make sure Andrew can make a few comments before opening it for questions.
Yeah, no, thank you, Keith. I want to hand over to Simon because he's got all the detailed analysis. So he's going to talk through the impact that obviously the COVID has had on York, but then also we want to just finish as well, just kind of talking about recovery and the likely recovery timelines, because I think they're quite important as well, both from an economic and a health perspective. So Simon, I'll hand over to you, and if you want to kind of just walk through the presentation, please.
Absolutely, thank you very much, James. And if Robert, if you could bring the slides up, that would be great. Really want to get across 3 main points to you. There's a lot of statistics here. I won't spend a long time going through all of the detail that will show to you, but there are essentially 3 things that I want to get across. Firstly, while a lot of the focus is inevitably on retail and the city centre, food and hotels and accommodation and the arts, the York economy is far more than those sectors. If you look in pure GVA terms, for instance, retail is about 8% of our York economy, which is actually less than Charlie's sector, less than education in terms of GVA for York, and less than finance and insurance, less than manufacturing, less than health and social care as a sector. So it's number 6 on the list of sectors in terms of contributions to GVA in York. If you add that together with food and accommodation and arts and leisure, that's about 1/8 of our economy. It is the 1/8 of the economy that's been most severely impacted in the short term, but we are going to need to be thinking longer term at the other 7/8 as well. But while it's only 1/8 of the economy in terms of GVA, it's actually about 1/4 of all employment in York. And really importantly, it's 1 in 3 of all part-time roles in the city. So they are very important sectors, certainly in the short term, in terms of household incomes. And in terms of how our residents make a living. We'll go on then to look at the city centre, and perhaps let's move on to the next slide, Robert. So the point really I want to get across around the city centre is that visitors are really important, particularly in terms of spend, hence the push to get them back. But as you've already discussed, that balance is what's really important. If you so I say about 1/4 of our employment is derived from customers' pockets, purses and wallets in the city centre, and 1 in 3 part-time jobs. This data that I'll come on to show you in a second is from collaboration we've been doing with Andrew Lawson and the BID. We've been exploring other ways of measuring the city centre economy. Historically, we've had this kind of information, which is about footfall. So that's about the numbers of people. And you can see here very clearly in that chart the impact on the city centre of a lockdown. So you can see in April, we were right down to about 1 in 8 of typical footfall in the city centre, as we all stayed well clear. By the end of August, by the August bank holiday weekend, we're almost back up to what you would normally have in York, and that since then has declined away. The lockdown we have just emerged from to tier 2 got us down to about 40% of normal footfall, so very different from what we'd seen earlier in the year in the first lockdown. And in normal times, about 1/3 of the people in the city centre are locals and 2/3 are visitors, but that's changed through the lockdown. And if you go on to the next slide, Robert, we'll see that actually this is a map which shows where people came to York from in the last week of October, so that's half-term week. You can see 68% of the people in York were actually from within 10 kilometres of the city centre. So the balance had completely switched. But actually look at the variety, look at the range of the draw of York from across the whole of the UK, and we can see just where those 2/3 of the normal people normally come from. I say numbers is one thing, but if you go to the next slide, the key thing really in terms of our city centre businesses is how much people are spending. And this shows you the impact of that first quarter of lockdown. Massive increase there in online spend, up by a factor of about 5. And not surprisingly, that's led to lots of additional jobs in terms of delivery drivers and things. But as we then went into quarter 2, look at the drop off in terms of spend through the tills. There was something like £170 million spent in the first quarter of the year, down to around about 65 million in the second quarter. So more than £100 million lost from the York economy in that second quarter of the year, which actually is, interestingly, is about the same amount as we gave out in grants and support in that same period, although of course that money didn't just go to city centre businesses, it went much more broadly than that. Next slide shows you then what happened when we went back into the third quarter. And you can see spend right up again there. Online spend pretty similar, but actually a lot more spend coming through the tills. About £200 million in the third quarter, so almost back to normal. Next slide, please. You can see where that money came. 40% of that went to restaurants. Lots on clothes and general retail and supermarkets as well, but clearly Eat Out to Help Out had a big impact. I know we've just been touching on what might happen in terms of restaurants in the summer. I'd say that 40 million is just what was spent in terms of Visa merchants, so people, not MasterCards and other things like that as well. So actually around 100 million in total was spent in restaurants in the city centre in the summer. And we know that the only time that's more important to our restaurateurs is the lead up to Christmas. I'll put the £100 million in the chat as a kind of best estimate for what might the impact of a lost Christmas be on our restaurant trade. So that just shows how much might be lost. Next slide, please. So spend is really important, but look where that spend's coming from. 40% of spend in the third quarter came from more than 50 kilometres away from York. So people setting off from more than 30 miles away from York, coming into the city and spending money and going home again. Although, as we've shown you, something like 70% of the people were from York. Over half, the biggest percentage, over 40% of the money was actually coming from 30 miles away. So even when the numbers are down, visitor spend is really important, which is why it's so important to retailers to be thinking about how we get those visitors back. But I just say now, in terms of the debate around tier 1, tier 2, tier 3, I've been very surprised to hear a lot of retailers and people in the trades really quite concerned about going into tier 2 and what that might mean for their businesses, although they recognise it might bring more money in through the tills. Don't assume that every business would want us back in tier 1. Next slide, please. This is the tourism dashboard. I won't dwell on this, but again, it shows you the severe impacts in terms of hotels, in terms of our attractions. So in terms of the city centre, so we can see just how much cash has been lost. And I've already said how important that is in employment terms, but let's go on and look at the broader economy. So next slide, please. So the other 7/8, and as it was very taken by what Rishi Sunak said in the beginning of his autumn statement, just to remind us all that actually, in terms of the more general economic impacts, we're only at the start of those. We feel like we're through the worst in terms of the city centre. We can see how a vaccine is going to enable people to come back to the shops again. But economic shocks like we have had more broadly take something like 3 to 5 years to recover from. And indeed, that's what the forecast that went along with the autumn statement suggested. They suggested an 11% loss of GDP in the current year, which for York would mean something like £700 million impact on the city economy. And as I say, they suggest that it'd be 3 to 5 years before we are back where we ought to have been without COVID, assuming that we are at the end of those impacts in terms of customers. Let's see what happens in terms of vaccines, and let's hope that we really are back to something like normal later in this year. Employment in York. This is a picture from before COVID. So this shows you that over the 5 years from 2015 to 2019, about 5,000 jobs were added to the York economy. The number of full-time roles stayed pretty stable, but actually there was growth in part-time roles, and there was growth in that little chunk at the top, which is proprietors working in businesses and the self-employed. So part-time work is really important to our city in terms of household incomes. About 40% of work in York is part-time compared to 32% nationally. That's not because we've got a deficit of full-time work. It's because a lot more people are working part-time because it's so expensive to live in our city. And in terms of, next slide, please, in terms of where those part-time jobs are, you can see here, they're clustered in retail, in hospitality, but also in education and in health and social care. And elsewhere, but the predominance of part-time work in our economy is in those lower paid parts of the economy. And part of our challenge in terms of how we might try and replace some of that part-time work is as much about showing to the professional, scientific and technical sector that there is great value to be had in having jobs that are of less than 35 hours a week. And indeed, it will allow them to offer work to a broader range of people, as it is in trying to find other equivalent jobs to retail. We know that we have a very highly qualified workforce in York. 50% of people have a level 4 qualification or above, so that's kind of degree level or upwards. 50% of the working age population. 50% of our employment is not graduate level employment, and we need to do a lot there to think about how we replace that part-time work, how we change employers' attitudes to part-time work, and get rid of some of those negative connotations as well about, we talk about part-timers as if they're people who aren't really interested in what they're doing. Actually, the ability of those people to really contribute to our economy is important in the future. Let's move on to the next slide, because this shows how the claimant count has risen in York. So how many people have lost their jobs so far? Well, it's not exactly that, is it? It's the claimant count. How many people have successfully claimed universal credit since the start of this? And this shows that has gone up from about 1,800 to about 5,000. But it actually shows you the data are actually almost over my entire working career, way back to 1986. And you can see from this graph, when I say it takes 3 to 5 years to recover from a spike in unemployment, there it is in front of you. Let's look at the 2008 credit crunch. There it goes, a big jump, and it takes 5 years to get down to anything like the level of claimant count there was before that. So, as I say, we should be thinking long-term impacts here, and those are not just economic impacts; they are social impacts and health impacts as well. And indeed, if you going on to the next slide, Robert, I've said that shows you how many people have successfully claimed unemployment-related universal credit. If you actually look at this wasn't the intention of these stats that were released in April. It's what's called the annual survey of hours and earnings. But the survey was done at the end of April, just as that spike hit us, and showed that in the 12 months to April 2020, we'd lost something like 14,000 jobs from York. Now, it is survey-based, so one does have to take the absolute, there's a plus or minus 15% to be applied to these numbers, but taking them at face value, something like 8,000 fewer male full-time jobs and about 5,000 fewer female part-time jobs, and it is gendered like that, would appear to have been lost from the economy. So what has happened? Why is the difference there? Why do we have potentially 14,000 fewer jobs, but only 3,000 more people claiming? Some of those people clearly have switched to other work. There's also, I would say, quite a large student workforce in terms of our hospitality and retail industries, people working part-time. And those people would have gone back to their home residence rather than their student residence. And then, as I said, there are a number of people not able to claim, partly because so many people rely on work on 2 incomes in a household, and that can rule you ineligible for universal credit. But there is a concern there around the broader social impacts from that. It's not surprising that we've seen an increase in people going to food banks. What we're not hearing is a great clamour from people about the challenges of unemployment, but that's partly, I think, to do with the difficulty is that for instance, our ward councillors are having in terms of holding surgeries and such like. I think there may be a problem out there. If we go on to the final slide now, this is, as I said, my third point was really about this is about far more than just retail and hospitality. This shows you side by side on the left-hand side what's happened to the workforce in a range of sectors. The dark blue being those who are on furlough, and there are still quite a lot of people furloughed in York, 6,800 people furloughed, down from what was actually 30,000 at the end of July. So it's come down very significantly, and a lot of people have gone back to work, but still 6,800 furloughed, and the majority of them in sectors like restaurants and hotels and arts and entertainment. So in museums, in the theatres, and in the cultural institutions of the city. So a lot of people there still furloughed, still at risk. And on the right-hand side, it shows you the impact on turnover across a number of sectors in the current year. And you can see those light green ones are all businesses who say their turnover has decreased. And across the whole economy, something like 45% of businesses have seen their turnover decrease. Those impacts play through a bit slower in the economy, and ultimately will feed through into some business failures as businesses simply run out of cash. The indications are that quite a number of businesses are now down to fewer than 3 months turnover in reserves. Again, that varies very much across sectors, but a large percentage, particularly in accommodation and food businesses. So the challenges lie ahead of us. I say we should be thinking about 5 years in terms of recovery, and we need to be thinking about finding replacement ways for people to earn an income, and think about how we can potentially use that to transition to the new economy that we want to see in York. Visitors are really important in the city centre, and we've got to remember that. But of course, the economy is far more than just the city centre too. So that's the end of my presentation, and hopefully I've left some good time for discussion and any questions anyone has.
Thank you very much for that, Simon, including the comprehensive presentation. I think what it really brings out is, in a sense, what we already know, that it has been tough for businesses, tough for particular sectors in particular, but that actually we've not seen, as you say, the full effect, and we won't see that through the economy into next year and beyond. And I think for me it reinforces those calls that we'd be making, that we've called Back York, as part of the council submission, for example, to the spending review, to say that although support that has been given to local authorities, to businesses, and the furlough scheme is welcome, it's still a drop in the ocean in terms of the impact across the board and the support that people need to retain jobs, and then actually to be able to then create new jobs afterwards and the new year. And we need to keep up that lobbying nationally to make that case. And alongside the impact on businesses, you see that impacting on councils, and then in turn our ability to then support businesses in our local area. So it's all part and parcel of that same picture, that I know that we in the council will continue to make that case at every opportunity to get that resources into the sector. Any questions or comments? Danny.
Thank you, Chair, and thank you, Simon, for presenting that report to us. I really do appreciate your work throughout this year, and those in the economic team in the council for producing varied ideas to counter the pandemic locally. I really do appreciate that. I wanted to get your take on the city centre and the figures that came out, I think, from PricewaterhouseCoopers around shop closures. I know sometimes these national surveys and figures that get published don't always tell the real story. So I wanted your view on that. And if it's anywhere near correct that there's been the highest number of closures in York than anywhere else, what else can be done in your view to combat that and quick have a quick turnaround on ensuring we don't have empty units and so on?
Yeah, the stats, or the story on the stats that you're referring to suggested that York was the most drastically hit city in the entire country. What I'd say is that prior to the pandemic, York was the city that had the smallest number of vacancies of anywhere apart from Cambridge. So it was only us and Cambridge. There has undoubtedly been an increase in vacancies in the city, and the council area more broadly since the pandemic started. We are still below national average in terms of vacancies, so we're still faring better than many other places. But yes, there have been quite a number of closures, particularly amongst some of the larger chains. And what we had been seeing over the last few years was a switch really from retail and into leisure and hospitality, so increasing number of restaurants. And there were quite a lot of the large expanding chains, the Jamies, this, that and the other, that had come into York and lots of other places on the back of a heavily leveraged financial model. And they have been really hit badly by having to close through the summer. So that's had an impact, and the number of businesses that have come and actually closed pretty quickly have been, that contributes to some extent. There are a number of the larger national chains that have been very seriously impacted here, and of course York being York, they've all got a branch in York, whereas other places they might, one place they do, one place they don't. York, most of the chains have got a presence, so those that have been impacted and have chosen to close down and are likely to have had an impact in York. So again, that adds another impact as well. I don't want to appear complacent about the number of vacancies. It is an issue. The challenges of how we work with the owners of bits of the city centre remain, but it has been pleasing to see an increase of local investors getting involved in buying premises in the city centre, and a sense that perhaps York needs to think again collectively about what we do with that. And we were just launching the My City Centre consultation exercise actually at the start of the pandemic, which I know there are plans now to get that going again. If we take that alongside some of the excellent work that James's team at the LEP have been doing around the changing nature of city centres and town centres and retail areas, there are lots of opportunities for us to make York, make sure that York is still a really attractive place for people to come to. What we need to do is find ways for people to spend money. But we have recognised for a while that we do need to try and think about the balance of people that are coming into the city centre, and this does give us an opportunity to think again about how we make best use of the spaces that we have, what we do in terms of promoting our city around the world, and as I've tried to highlight earlier, if we aren't going to have so much retail in the city centre, we need to think, well, how are we going to provide the range of flexible, particularly part-time work that enables households in York to earn the money that they need to live in our beautiful but rather expensive city.
James, did you want to come in?
Yeah, just back up what Simon said, and again, I think on a retail, I think Simon and I were speaking yesterday, and the next wage bill is due in January, so there are some big national chains who are very highly leveraged. Obviously, Arcadia Group has been in the press and Debenhams and such like, and I think there's potentially more impact to come, which we'll have to wait and see. So I think we're going to have to look at obviously the future of the city centre in York. I think what we can't get away from those, we have to sit in this position with some confidence. York is still the most sought after location in the UK where people want to live. As people work more digitally and more remotely, quality of place will be a much bigger driver in where they want to locate their business. And we're already seeing this in some of the inward investment kind of conversations that we're having with people now. People want York, people like York because it is such a great place. So there's clearly going to be a fairly significant impact. And I'd be interested to see what Andrew Lawson's got to say, if you like, on the ground from the Business Improvement District. But we have to be quite confident and aggressive going forward, because York remains an absolutely fantastic city where people want to live. There are some great businesses in there. There's some fantastic independent shops, and we need to kind of have that confidence in the offer that we're putting forward. But I'd be really interested in what Andrew's got to say.
Thank you very much for that. Julia, I know that you've got a question. Would you mind if I go to Andrew first to just follow up, and then I'll come back to you in a second. And then after Andrew's spoken, Simon, the other point that we haven't mentioned is around support for businesses in terms of grants and obviously the most latest round of discretionary grant payments, which I know we've obviously worked to make sure, as we did previously, that we've paid them as soon as possible. Whether you wanted to mention that support as well, Andrew.
Yeah, I mean, I won't talk for too long because obviously there's lots of feedback I could give from the city centre, and I think we're at that stage where it's not just a case of how's retail doing or how's hospitality doing. Going back to what James said a little bit, it breaks down to subsector, because some hospitality does better than others. Coffee shops are very different to hotels, obviously, and how we've been impacted by people not coming here makes a big difference as well. So, I mean, these spend figures that we're getting from Visa, yes, that they are very insightful, because I was just looking at some of the slides that I've got, which looks at the 3 quarters leading up to Christmas last year, and there's about £70 million worth of spend that comes from people who live further afield. But that's because they come stay here, they'll have several meals, etc. And I think we've got to be realistic that even though we've got a good support the city centre campaign in the next few weeks leading up to Christmas, that spend's not going to come from locals. So I think we probably will see some more business failures in probably January to March, because that's often where you see them anyway, in the city centre. But again, I think we are quite lucky that we've got a strong independent base, because I think the independents, what we've seen, they've been very fleet of foot. They've managed their overheads well. They adapted quickly. Obviously, their premises are smaller, so the overheads aren't as large. So I'm hopeful that a lot of our indies, a lot of our favourite shops, whether that be little retail or cafes, etc., will make it through to next spring, where we're all hopeful that times will be better. But yes, the large plate retail is probably the ones that we need to worry about. But that was a problem before COVID. And that's across the UK. The way that city centres have been designed in that traditional retailing model, that's been evolving for a long time now. And I suppose if I'm trying to look at positives, the fact is actually this will probably speed up some of the things that we need to do as a city. I know it's definitely, we're having conversations that are moving a lot at a greater pace. I mean, just going again to what was touched upon, we're hearing from some of the property developers that some of the institutional, the pension funds, etc., who own a lot of property in York are actually pulling out. They're coming out of retail, and that is giving opportunities for local developers to actually buy these properties. Some of them at hugely discounted prices compared to a year ago. So I think again for the future that's going to be a positive, because then that allows us to work with local people to look at these buildings which aren't fit for purpose anymore, and you break them down. You look at mixed use, more office space, which we often talk about, residential, affordable housing, etc. And I think there could be some really exciting opportunities. And I think, I'd just like to say a thank you to the council and other partners, because, it's great that we've seen things such as York Central, Castle Mills project, station frontage, because these are all the regen projects that I think will link into this redesign of the city centre. But you need those catalyst projects, as we've just mentioned, and I think it's been great to see progress on those in the last few months, because I think these are the things that will get businesses excited and help us look to the future. So I think the only final thing I was just going to touch on, I suppose, and this is more just I suppose pondering on something that Simon said, because completely take his point, looking at the graphs of how long it might take to recover. I mean, the fact that we have been hit a lot, in that hospitality and retail, a lot of those jobs are what you might call gig economy jobs. And whether we want that or not, that's a debate for another time. But the fact that those jobs have gone quite quickly, I suppose my one hope is that maybe it won't be as long a recovery period as some of the other recessions, because if we can get visitors back for York, for example, if we get people spending and, retail and hospitality can come back quickly, obviously with the gig economy, that means jobs can come back very fast. So I suppose that's the one thing that makes me hopeful that whilst I'm fully aware, there's some tough times to come, it might be that actually in those industries, things can bounce back quite quickly, depending that, that obviously health goes in the direction that we want it to.
Thank you very much for that, Andrew. Appreciated. James, did you want to come back in on a point there?
Yeah, and it was, I suppose, just to throw in another positive, really, for Andrew, in that we mustn't forget as well that the international travel is going to be significantly lower for quite a number of years. So therefore, people are going to be staycating in the UK. So if you like, the rollout of the vaccine, so people have got the confidence to come to kind of York is going to be so absolutely critical in this. But assuming that kind of rolls out as we planned over the next quarter or the first quarter of 2021, there are going to be a number of years where there's going to be far greater domestic visitors and holidays than international. And again, York's popularity and that should create an opportunity to bounce back for hospitality and retailers, as Andrew said, hopefully quicker than that 2023 period.
Thanks, James. Julia.
Thanks. I just wanted to pick up on something that Simon said, and that was the opportunity this presents to sort of rethink the offer in the city centre. And we've had conversations, Keith, for many a conversation around the nighttime economy and the stags and hens and all of that sort of stuff. And we've done surveys around what local residents feel about that type of thing. And I suppose it'd be really keen to sort of engage with wider partners around all of this and take this as an opportunity to really look at rebuilding and perhaps changing the emphasis a little bit. And I think people, that would be an interesting thing to explore, to try and alleviate some of the sort of tension that we've seen in the past between, the sort of drinking and the families and all of that sort of stuff. So that's the first thing. And then the second thing, I just happened to be on a call. Danny reminded me, he mentioned PwC. I think the consultants have been active, but I was on a call recently with Deloitte, and they've done some interesting research with the public in the Yorkshire and the Humber region around the public's views of their priorities. I think it's a little bit skewed towards West Yorkshire, but it's interesting nonetheless, and worth I think looking at. It was a sample size of 5,000, so it's quite a significant sample size. I can share that as well.
Thank you very much, Simon.
Yeah. So firstly, just to come in on that one again, I think you're absolutely right there, Julian. I think Andrew's mentioned some of the projects we've got ahead of us. The refurb of the Guildhall and the it's going to be really exciting as we work with the university to think about how we can use that to support new businesses emerging in the city centre. And another way of finding customers for our city centre businesses as well is to grow the non-retail hospitality employment in the city centre. We've lost quite a lot of office space, and it'd be good to get it'd be great when the Guildhall's open again. And then just to come on to that piece that around what we've got in terms of grants at the moment, though the grants are very closely related to the tiers. when we were in national lockdown, there were a whole series, I think there were 6 grants that we had open on the website, which we're getting through really quickly in terms of processing those applications and getting the money out. And then money to provide what they call the additional restrictions grant, a discretionary fund, which we've used our discretionary funds in York to really try and help particularly small businesses that have fallen between the cracks of all the other support schemes. Earlier in this year, we used £1 million of our own council resources to support over 1,100 micro businesses in York, which has given us a great insight actually in terms of what people are doing in terms of small micro business and what we might think more broadly about as entrepreneurship beyond the kind of Richard Branson model, and already talking with some of Charlie's colleagues about how we might use that to better understand the needs, particularly of micro businesses in York. We've been able to go back to them again and offer another round of discretionary funding through that lockdown period. It's not available at the moment. We can only provide it during tier 3 and during national lockdown, but we've kept money back on the, well, we really don't know where we're going in the months ahead of us, do we? And a lot of the country remained in tier 3 and was able to give grants out at that stage. We've had about 700 and close to 800 applications now into that discretionary fund, and there are a lot of businesses that, while we're only giving out relatively small amounts of money, it's really heartening to see what a micro business can do with £1,000, and the number of businesses that have come back to us and said actually that was been the difference between them continuing trading and closing down. It's really important. The knock-on effects of all of that in terms of all sorts of aspects around health and social impacts, really important. So our focus has been on supporting small and micro businesses. We've tried to get the money out to as many as possible, and we've also been working very closely with all the business networks across York. So of course, Andrew in the bid, but also the Chamber of Commerce, the Federation of Small Businesses, and we've supported them to take their membership up from about 800 to about 1,500 businesses in York are members of the Federation of Small Businesses. Nearly 1 in 5 of all businesses. That's enables us to communicate in a much better way. So part of the work that Claire's team has been doing is working with us to get business bulletins out at least once a week to as much of the business community as we possibly can. And we're constantly looking for ways to spread the word further around that. And then looking at how we can build on that great network that we've put together, I'll say, with the FSB, with the Chamber, with the BID, with the Institute of Directors, and also with the universities, to think about what we can do more broadly in terms of providing business support and advice to small businesses. And we're looking at developing a business support scheme for that. We also have a bit of resources held back to support further opening of the city centre next year, which of course will be led from a what's healthy and safe perspective rather than how do we get the cash back, but tries to balance both of those aspects. So most of the grant schemes are not open now because we've come out into tier 2. There are some grants still there though for tier 2 businesses, and if anyone knows anyone that's having to be shut at the moment or whose trade is severely restricted, then point them at us and we'll see if they're eligible. We've tried to give everyone that's eligible the money that they are entitled to.
Thank you very much for that, Simon. Mark.
Yeah, so I just wanted to touch on the point that James mentioned about the international travel, because I do think there is potentially a little hole developing where we need to make sure that organizations such as Visit York and the whole partnership model that we established are really agile in responding to it and attracting and focusing funding in terms of advertising, selling York to the right market, is focusing on the right places within potentially the UK, because that staycation market clearly is something that we have big hopes in. And I think, again, Andrew will probably agree that the York bid has a role to play there as well, but we need to make sure that the organizations that are involved all almost kind of pool their resources and we're not taking like a scattergun approach, but making sure that we're aligned in our initiatives to bring those people into York and boost the economy and really accelerate that recovery in that respect.
Simon?
Yeah, absolutely, very much. In terms of how we promote York, particularly to visitors, it's on this close to home. It's a kind of 3-pronged approach. So we do some work on that. We work with Visit York and Make It York to do that. We also work with Welcome to Yorkshire to do that. And we've recently been considering the support that we provide to them. So that's our kind of home team in terms of what we're doing in terms of trying to promote to the outside world. I was talking this morning with them about how, for instance, we might try and use the Rugby League World Cup later this year to think about what we do in terms of people coming from Australia and France and elsewhere around the world. And then we work, of course, with Visit England, Visit Britain, and the national organisations that are promoting York and the rest of the UK around the world. But the domestic market has been really key to York tourism for a long time. Although we do sometimes have a bit of a focus on international visitors. So important to remember that something like 90% of the visitors to York come from the UK and not from overseas. So York is very well known and very much loved by the people of the UK. That's why we keep coming top in all sorts of polls, and converting that into people coming and spending money in our city when it's safe to do so will be absolutely key to our approaches. And in terms of segmenting, it's also important to look at kind of which, are we looking at families? Are we looking at older people with money to spare? And thinking about how we promote York more broadly and making sure that we chime with the right audiences is really key to all of that.
Thank you very much. So I think a little bit like the last couple of items, there's an awful lot of thanks that we could give to all of those businesses that we know have worked hard to become COVID secure, to adapt their services and respond to an ever-changing situation, but through to those associations. You mentioned Chamber of Commerce, the FSB, York Bid, who have done an awful lot of work in terms of communicating and supporting all of those businesses, and to your team and also others at the university and Make It York that have helped make sure that support is processed and gets out as quickly as possible to those businesses. And so I think for this item, we're obviously noting that presentation, if we could record our thanks to all of those different organizations, but it does really bring to home the importance of that ongoing lobbying work that I know that we're all doing combined to make sure that there aren't gaps, that businesses aren't dropping through the gap, so to speak, and then we'll keep making that case as much as we can. So thank you very much for that presentation and for all of your comments. That then takes us on to agenda item 8, which is a presentation on COVID-19 testing, and then we've got agenda item 9, which is on COVID-19 contact tracing. Sharon and Fiona will have been watching the clock, and we should just about do it time-wise, but I'll just give that as a little reminder and then hand over for item 8, COVID-19 testing.
Okay, thank you. So Fiona's going to take us through a presentation that will cover agenda items 8 and 9 together, which will help time-wise, I think. Just by way of introduction, really, I just wanted to say that when we talk about the recovery of the city from the pandemic, the economy and the health are kind of a side by side, really. It's not all health or the economy, it's both. And we've talked about a vaccine, which is fabulous, but we're not going to have a vaccine in large enough quantities immediately. And so the way to help the economy of the city is to keep our numbers down, keep us in, a lower tier. And the way that we do that is through testing and contact tracing. So that's a very important part of supporting businesses and the economy as well. So I'll hand over to Fiona to take us through the presentation, and there is a decision that Fiona will be asking the board to make at the end of that presentation as well. So over to you, Fiona.
Okay, thank you. So yeah, I'll try and get through all the information quickly and draw you to the bits that we really want to focus on. So just if we go to the first slide, it's just a bit of a recap in terms of, so we came to the last meeting and we put out what we wanted to do in terms of our priorities around using these lateral flow tests that had come online, and we talked a lot about that, and we agreed that these were the priorities that we would look to work towards. We also decided in the meeting that in terms of our adult and children's social care workforce, we very much wanted to include the voluntary sector workforce in that as well. We agreed that we wanted to not just have a central site, but we agreed that we wanted something that could be taken out into outlying areas of the city, particularly where our infection rates were highest, and looking ahead to next year as well, and later in the year, how those tests could be used in terms of getting events up and running. And if we go on to the next slide, obviously, almost immediately after we had that meeting, there were quite a lot of updates. So on that slide, it just shows, the next slide shows those updates and what was announced nationally. So firstly, the government announced that they would roll out a programme to make lateral flow tests available to enable people to visit within care homes, and I'll say a little bit more about what's happening in York on that in a moment. They also extended a national programme to widen the regular PCR testing to those who provide care to people outside of the care home sector. So, for example, those people who go into people's homes to deliver care. And also what's happened since the last meeting is that we're starting to get some of the learning through from pilots that have been happening elsewhere in the country using lateral flow tests. So it's a really quick moving environment that we're working in, and we're kind of trying to keep a pace with that and coming to you with now some options in terms of what we do in the next few weeks and then slightly longer term within York. So just first, before I get to that, on the next slide, I just want to talk very briefly in terms of test accuracy. I'm sure people have been listening to lots in the media around the accuracy of these tests, and so we do have to be upfront about the limitations and what these tests can do. So, and this will hopefully help you with the decision that we want to ask you for. So this is just taking an example. If we were doing testing at one site, so we're looking at doing that. So in a week, we could test approximately 4,000 people if we were running one site for 7 days a week. We know that no test is completely accurate. So this scenario is for if we have a test that has a sensitivity of 60%, and that's roughly what some of the pilots are showing, you might get a test with that level of accuracy. So as you can see, if you're doing that testing where your prevalence is 2% and then a lower prevalence of 0.1%, you have quite differing figures. So you have much more impact when you're testing in a population where the prevalence of the virus is higher. So, but even in a high prevalence population, it might seem like a lot of work to find potentially 48 people that are positive that wouldn't have gone for testing because they don't have any symptoms. We also have to accept that some people will be falsely told that they are positive. But within any testing program that we look to do, there will be a requirement that any positive result on a lateral flow test is followed up with a PCR test, so we can overcome that issue of any false positives. There are also some people who do have the virus, but a lateral flow test won't pick them up. So that's the false negatives there. So it's really important in any of this testing that we do in terms of those comms messages, so that people that have a negative lateral flow test don't get the idea that that's then their license to go out and do what they want. Those messages around hands, face, space will be important still when we're operating doing this testing. And then just in terms of the next slide, it's just a bit of just to give you a sort of visual representation. So going back to that point about, is this a lot of work if you only find 48 positive cases? So this picture kind of illustrates that actually finding 48 people would be beneficial, because for every positive person that you find who you wouldn't have previously because they didn't have symptoms, there are contacts who, if not isolated, could potentially go on to infect other people. So testing is really one tool that we have to get that R value down. So on the next slide, just looking at our strategy for York. So we have been working to establish a testing offer for our residents, which could go live as early as next week. And we're looking for agreement from board members in terms of which of these groups we want to prioritise to offer testing to first. So the two groups here, so the first one, people who work in retail, hospitality or the transport sector that come into contact with a lot of people. So this is where your prevalence is likely to be higher. So this is where you'll likely find most people who might be positive. And in terms of that visual, in terms of the contacts that people have, their bubbles as such are likely to be bigger because they are coming into contact with more people. And then the second potential priority group, the members of the population who have contact with vulnerable people, either through their work or a voluntary role or an unpaid caring role, we would put that group forward. Although prevalence might be lower, obviously the consequences of this group passing on infection to other people when they don't know that they are infective is also higher. Obviously higher consequences there. So that's really kind of the decision that we're looking for board members. Going on to the next slide, so then just to talk about the sort of strategy and how we look to roll it out. So our wider strategic plan is to have one site that we could have available to go live pre-Christmas, and we've been working in partnership with the York St John University, so much thanks to them for the support and collaboration that they've given us on this. Obviously, that's the immediate over the next few weeks. We will then be looking at what other sites would we be able to use for testing, and we'll have learnt from that first site. And as talked about at the last meeting, we would want to look at sort of pop-up sites within York where our prevalence might be higher. We're also looking at the potential of a postal offer for care workers who aren't covered by those national programmes. So particularly, as we said in the previous meeting, council staff and also voluntary sector staff. We had hoped we might be able to do that quite quickly, but we don't have the go-ahead to do that nationally at the moment. They've just rolled that out for NHS frontline workers, and I think they're wanting to wait and see how those pilots go, and if they're successful, we may get a go-ahead to be able to do that. And then the last point there in terms of what we're doing around testing is obviously now that the care home sector testing is a national programme, we're looking at how we can support that sector in York. So just very quickly on that, on the next slide, just to say a little bit more about that. So there is a cross-partnership working group looking at the support that we can offer to care home managers in York. There are joint partnership meetings, apologies for the acronyms, between public health, the clinical commissioning group and adult social care, and we've been doing some sort of question and answer webinars for providers. We've developed a flow chart for testing and visitors letters that care homes can use to support how they communicate out to family members of residents. And we've also been kind of looking at learning regionally and nationally and feeding that back into sessions so that we can revise our guidance locally, and we have now revised our care home visitor guidance, including how care homes could use lateral flow tests within their environment. And I think what we've got at the moment is, care homes are concerned about this and their capacity to be able to deliver lateral flow tests. I think there are a couple that have had deliveries of tests and others who've been told that they are coming. So each individual home is obviously looking at how they'll be able to do this over the coming weeks, and we'll continue to support them with that. So I do have a few slides as well on local contact tracing to update people on how that's going, but I don't know if you want me to pause at this point just on the testing to get to that decision around what our priorities are, and then I can just give a very quick flavour.
Yes, please.
Yeah.
Obviously open it for any questions, comments or support on that prioritization. I think the only question that leaped out to me in the second category, when you say those that work with or volunteer with those that are vulnerable, just what the definition of vulnerable would be there.
Yeah, and I think we kind of laboured on that, and whether we use the sort of clinically extremely vulnerable definition, but coming back to the point that Julia made earlier, and people trying to make decisions about what they do over Christmas, and elderly relatives, for example, who might not be in that clinically extremely vulnerable category, but people would feel like they would certainly want to do everything they could to protect them. We feel that probably this is something that individuals would have to determine themselves. They know the vulnerabilities of their families and friends.
Thank you very much for that, which certainly helps clarify it for me. Any other comments or questions? Does that mean that everyone on this call thinks that the two categories that Fiona has suggested with that caveat there are sensible prioritizations? I can see nods, and thumbs up. So thank you very much. So if anybody doesn't agree, so now's the opportunity to say, oh, Sharon, I hope you don't. I hope you do agree, but.
Fiona, isn't it either or?
Well, I think
you have to go for one.
So I think the thing is that we've never done this before. We really don't know what the demand is going to be in terms of testing. We will have one site initially operational. So, if there's a real demand for this, I guess we initially have to target this to focus on who do we want to invite forward. And it may be that if the demand isn't great, we can open it out to both those groups. But in terms of testing it, certainly for the first week, we kind of want to have an agreement on who do you want to target first before we're able to open up wider.
Yeah, almost I would ask for sort of public health recommendation, because to me, both those categories of people are important. Both those working, as said, in transport and retail that contact lots of people and will be working throughout Christmas. But as you've said, those that are coming into contact voluntarily through work, vulnerable people or with their families, those that are vulnerable, would seem important?
Yeah, so taking all emotion out of it and just looking at the science, in terms of the science of the testing, you would say go for the group that are most likely to have lots of contact, so that kind of retail, hospitality sector work, because that's where the prevalence is higher and that's where you will find most cases, and then you can put the public health action into place. And another point to make on that as well is that people who are vulnerable have to go shopping, have to get on a bus, etc. So actually reducing the transmission within those sectors will also protect the vulnerable as well.
You also mentioned there, and then I'll bring Alison and Bevan. You mentioned that you're almost looking for a group to categorise when you get that York St John site up and going, but you seem to be indicating that hopefully if the capacity's there and it goes well, you could then extend it to that second group as well. Is that the hope?
Absolutely. I mean, and Charlie sort of said, earlier he alluded to how they've set up testing in the university. It's a huge amount of work getting a site up and running. So we've been able to hopefully do that. And then, but it takes time. So we will expand the offer as we go on. But this is a very sort of immediate next few weeks offer.
Thank you. I would come back on the timeline on that actually, because again, that's that eye on Christmas and what those in that second category might then be asking. Bev.
Yes, thank you, Chair. A really difficult call, but the thing that strikes me with the two options is what the outcome is and what's the biggest and the greatest good. And also, of the two options, what's the impact going to be? And I'm thinking about when you talk about putting the health protection controls in. So will we get a lot of people self-isolating across retail, transport? And I'm not saying that's wrong, because absolutely we want to cut the transmission down. But I do wonder if we need to look at an impact analysis as well.
Alison, and then I'll go back to Fiona.
For me, it's difficult as well. And just to sort of give the case, I suppose, for the voluntary sector stuff is that, we know there are lots of people in York that we haven't been able to reach, that are lonely and vulnerable and very isolated. And my hope is that if we can test the workforce, paid or unpaid, we'll be able to reach those people that we can't reach through technology. So from my point of view, they are a priority group, but I completely understand it's a dilemma and I don't have a particular answer either way. But just to say, it is because we've got a lot of people suffering emotionally because they're very cut off, basically.
And I'll go back to Fiona, but then I don't know if Andrew or Mark, from a obviously retail and transport perspectives, you wanted to add anything, but I'll give you the opportunity to think before I bring you in. Fiona.
I'm just going to say, on the point of, do you find people and then they have to isolate and then it has a business impact? I think what we've seen throughout this pandemic is that actually if we find one person in a workplace who is positive and we isolate them, that then what that does is it stops the second and the third and the fourth person in that workplace becoming positive. And actually, you might have a small cluster of cases in a workplace, but what you don't have is a whole workplace shut down because the infection is transferred before you realized it was there. So I don't see there be, and what we've also seen is that you don't pick up thousands of people through these lateral flow tests, because we know that the prevalence is reasonably low within York now. So I don't see that is a big issue.
Thank you very much. Mark.
Yeah, I think it's an extremely tough call because, as Alison said, it's recognizing that there's a lot of people spending their own time looking after some of the most vulnerable in the city. At the same time, I made that point at the last meeting, looking after those and recognizing the potential impact of any kind of clusters in retail, public transport, and so on has a huge opportunity. There's a big risk that spreads very quickly within potentially these settings. So it will not come as a surprise to you that I will probably advocate to go for that group, but by no means is that not, or is that saying that the other sector isn't equally important. I just think the time that we're looking at, especially with the increased amount of mixing that might be going on in the next few weeks, starting from as low as a base as possible there is something that I would certainly think is the right thing to do.
Andrew?
Yes, as a guest, I was hoping to duck this question, Keith.
You can.
Due to it being quite, well, yes, it's difficult, isn't it? I mean, obviously, I suppose in my position, yes, I would agree with Mark. And I suppose just looking at one of the benefits, I suppose, when we've been talking about, communicating earlier on, communicating messages of safety and how we're looking after our frontline workers, people who are there making the city safe. That's probably, again, why I'd probably favour that option. But yeah, I understand it's a difficult choice.
Thank you. Fiona, I want to come back to that point on time scale. So there seems to be general acceptance is a very tough choice that nobody would like to make, but if you did prioritize those, in a sense, key workers, it is how quickly do you think the capacity would be able to be built up to then enable us to extend it to that second category of people? Would there be any capacity prior to Christmas, or is it more likely in the new year?
So we're certainly looking at to have the one site before Christmas with another site, probably not till the new year. And it does depend as well what, as I say, what the demand is. Because if people aren't, that keen to be tested, we can obviously expand it out and target other groups as well.
Yeah. Thank you very much. And I know, Fiona, that obviously more information will be going out in terms of for the group that is selected, how, for example, to book and apply to get a test tomorrow. Mark, and then I'll go to Lisa. Mark.
It's just very briefly, obviously we have a number of larger organizations in that sector, both in public transport and retail and so on, and it's maybe just exploring, is there anything that those businesses can do to help with the efficiency of the process, which then as a result might free up more capacity to include the data group. So I think it's just an offer really, certainly I'm happy to take that up with the various public transport operators where I can, if that helps.
Thank you very much. I can see both Sharon and Fiona nodding at that offer. Lisa.
Thank you, Chair. And yes, I think it's the monitoring during the early days, isn't it, of the capacity and the number of people coming forward, because as we've discussed here previously, there might be a reluctance, particularly 2 weeks before Christmas, for people to come forward and then face isolation, can't go out, can't fulfill their Christmas plans that they've already made, etc. So I do think there's something about the timing of the site being open and people's willingness to come forward if it could then restrict their movement for the 2 weeks of the plans that they've made.
So Fiona, do you want to summarise what you think we've decided, and then we can clarify if we haven't?
So I think what I'm hearing is that people, even though it's difficult, there is a support that you go with where you're likely to find the most cases first. So that's the sort of retail hospitality, but definitely, with a view that we will expand it to other groups, and we'll do that as quickly as we can, depending on what the demand is. I think that's what I've picked up from the comments.
Yes, and I'm seeing a few nods along those lines. And obviously, I'm sure this is something the Outbreak Board, I know we're not meeting until January, but I'm sure we'll want an update on when we get to January.
Yeah.
Thank you very much for that. And I know you had a few more slides to just.
Yeah, I know we've run over, but just very quickly, I don't know if you can pop those slides back up again, Robert. Just very quickly wanted to just say something about the local contact tracing service. I think if you skip on to the next slide. So as you know, we went live at the end of October. You can skip on to the next one. So the red line is where we went live. Nationally, they add our figures into what they report nationally in terms of how many cases are contacted. So you can see the rates have gone up to almost 90% since we started delivering. But I just really wanted to, in terms of a bit of more of the qualitative. So on the next slide, just got a bit of a case study from one of our contact tracers who talked about going out to do a home visit because they hadn't been able to get in touch with somebody. And they met the family members who advised that the case was in hospital, and that was why they'd been unable to take the call. But fortunately, one of the family members agreed to do the phone call with our contact tracer, and they were able to provide quite detailed information on the case's past activities and the contacts they'd encountered. So that means that those contacts were able to be followed up by the National Track and Trace Service and given the advice to isolate and also to access isolation payments if they're eligible. And like likewise, family members were able to be given all of the necessary advice around their isolation periods. And again, they would then be able to access isolation payments if they're eligible. So without that local contact tracing service, a family may know they have to isolate, but they're not able to get access to the isolation payments until they're within the national track and trace system. And then also another one that one of the contact tracers told me about, they had visited someone at home, arranging to do a phone call initially, and when they did that phone call, the person offloaded about the stress and anxiety of self-isolating. They talked about the pressures they and their family were under, and about actually that they'd been waiting by their phone for a few days, wondering why nobody had been in contact with them. So the contact tracer was able to give support and reassurance, as well as apologising that they'd had to wait. What had happened was the phone contact on the NHS database was incorrect, but we were able to explore other means and kind of get a phone number for them. So as well as engaging fully in the tracing process, the person also spoke about the dilemma of their home situation. So our contact tracer was able to signpost them to help. And the contact tracer said, I also talked a little about support the person can access with feelings of anxiety and isolation that they talked about openly. Of all this information I provided, they said the most important thing about the call was being able to talk, to share, and to realise they're not alone, and hold a hope that they can all start getting better before Christmas. So I'll stop there, but I just thought it was really important to, share that we are getting through some of these kind of personal stories that people are sharing. In terms of those personal experiences that they're having when they're speaking to people, and the difference that it's making at that kind of individual level to people when they do have that conversation.
Thank you very much for that. And I think we've seen again in the media over the past few weeks the York model being held up and looked at, including that work on local contact tracing. And I think those stories sort of sum up exactly why and why we should share that as widely as we can. An opportunity for anybody to ask any questions, if not obviously just to thank you and again the teams that are doing that work and will be doing that work through until next year. So thank you very much for that. That then takes us on to agenda item 10, which is just to say, if any of you have any agenda items for future meetings, do just send us an email or get in touch outside the meeting, and we'll add that onto the future agendas. Item 11 is dates of future meetings, and our next Outbreak board is scheduled for Wednesday, the 13th of January. So we just need to note the meeting dates. And then item 12 is any other business. You'll be pleased to know I don't have any other business, but just to say thank you to all of you and the work that your different organisations do, particularly as we approach Christmas, and it's bearing in mind those that are going to be working throughout Christmas as well, and send our thanks and best wishes to all of them. But I'll see you again as an Outbreak board in January. Thank you all. Bye-bye.
Confirm the live stream's now ended.